Thank you, Mr. Chairman, and thanking Ranking Member for reminding us of our oversight responsibilities. And I also want to thank the two witnesses for your strength, for your integrity, and for not staying silent. The fact that you were even finding out important information through tweets, it's not the way we operate. That's not the way we keep our country safe and our public's health, keep our public healthy. And so I want to first thank you both. I know you both mentioned as scientists, as doctors, and as parents. That's why you're here. That's why you care. And so last week, I led an in-depth discussion with experts on how Secretary Kennedy's vaccine policies are creating a lot of confusion in this country and harming families. And I heard from a pediatrician, a parent, a school nurse, and two former ACIP members who were fired by Secretary Kennedy. I'm extremely concerned that the Secretary has now stacked the committee with people committed to his agenda. As you said, the concern is the focus shouldn't be on ideology, but on evidence and on science. To put them there, Secretary Kennedy accused former members of being, quote, plagued with conflicts of interest and used that as a pretext. A question for both of you. Did you ever observe anything that cast doubt on the scientific abilities of those members?
I would actually just state, Dr. Monarez and I had worked together when she was acting director, and we posted conflicts of interest for the past 2 decades of the ACIP members to really embrace what the president had said around radical transparency and to dispel the conflicts of interest. We have a rule at ACIP, or we did when I was there, I can't speak to now, but if you had any sort of bias, you recused yourself from that discussion and that vote. And if you had significant biases or conflicts of interest, you weren't included on ACIP.
Were you ever present with any evidence of conflicts of interest that impaired the decision-making of any ACIP members, the former members?
I was not, but I would just note that I can't speak as much to the current ACIP members. One was an expert witness against Merck, but participated in discussion on Merck.
Great. Thank you. And Dr. Monarez, if there's anything you want to contribute, I'm trying to understand if there are any reasons that we should think that these individuals should have been fired. You could say, no, I don't know.
I had the ACIP members that were fired after the April meeting. I had not interacted with them. I had no, preconceived notions.
And Dr. Houry?
And I say I can't speak to them individually, but what I can tell you is when you look at the members, you look at geographic representation. I know that one was from the Midwest, focused on immunocompromised patients because that was a need to fill. You look at it as a whole of expertise, and that's what ACIP was.
And I want to go back to something, the hepatitis B shot keeps coming up, and I want to know, Dr. Monarez, is there anything that you want to clarify or say more about this? I mean, it's my understanding that before 1991, when not all babies were vaccinated, about 20,000 babies were infected each year, and that after the CDC's recommendations in the 1990s, that dropped by 99%, this terribly contagious disease. And the reason why we test everybody is because certain moms might not have been tested and don't know that they have it. So is there anything else you want to add? Because I know this has come up numerous times.
I think those are consistent with the information that I have associated with hepatitis B and its the promise of the vaccine. I do want to touch on one thing that was brought up in the context of that discussion, that CDC forces people to get vaccinated. CDC doesn't force anyone to get vaccinated. CDC provides recommendations supported by evidence to allow parents and physicians and others to make a choice, a decision in the best interest of themselves or the health of their families.
And one last thing I want to clarify as well. We talk a lot about ACIP members, but behind the scenes were these work groups, these working groups, the American Medical Association, the American College of Physicians, the American Geriatrics Society, American Osteopathic Association, the National Medical Association, the National Foundation of Infectious Diseases. It goes on. These were the groups behind the scenes making these recommendations, and they were to your testimony, Dr. Houry, pulled back and said, no, thank you, we don't need your help. Is that correct? Is that accurate?
Yes, they were pulled off the work groups, and I do think when we have experts, whether it's from societies or just with specific expertise, it's very much needed, and these organizations help with implementation. And we say, talk to your doctor. So we need those doctor organizations participating.
As a grandmother and a mom, I just want to say thank you for the work that you do and have done. And these are unsung heroes, people behind the scenes, just like those thousands of CDC employees, those who are fired and those who remain and still need our support. Thank you, and I yield back.